इधर नहीं है। कहाँ है? किसमें? मैं बोल दे रहा हूँ।
Titta på det boystorn.
How are my brothers and sisters?
Check, 1, 2, 1. Excellencies and distinguished delegates, I welcome you back to this afternoon sessions of the 76th sessions of the WHO Regional Committee for Southeast Asia. I hope you have enjoyed your lunch. Let us take up agenda item 3, credential of representatives. I would like to report to the regional committee that in line with rules 3 and 3 BIS of the rules of the procedure of the committee, I, as the chairperson of the 76th Regional Committee of Southeast Asia, along with Her Excellency Dr. Elia Antonio de Araujo dos Rios Umbral, Minister of Health for the Democratic Republic of Timor-Leste, and the Vice Chairperson of this session of the Regional Committee, have examined the validity of the credentials of representatives, including alternates and advisors from the participating member state in the region. It is my pleasure to report to the regional committee that the credentials from all these member states are found to be in order. It is therefore proposed that the regional committee recognize the validity of the credentials presented by the participating member state of the region. Are there any observation? No. In the absence of any observation, I declare that the distinguished delegates are in agreement with the report on credentials and that the regional committee accept the credential of representatives received from the participating member state of the region as valid. Distinguished delegates, we will now take distinguished delegates, we will now take up item 4, adoption of the agenda. May I request the Secretariat to introduce the agenda?
Thank you, distinguished Minister. Excellencies, distinguished delegates, I warmly welcome you back to the 76th session of WHO Regional Committee for Southeast Asia. I will now introduce the agenda for this 4 days meeting. In accordance with the Rule 7 of the Rules of Procedures of WHO Regional Committee for Southeast Asia, the provisional agenda of each session shall be drawn up by the Director in consultation with the Chairman. Accordingly, the draft provisional agenda was drawn and approved by the chairperson of the 75th session of the Regional Committee, Honorable Minister of Health, Royal Government of Bhutan. The draft provisional agenda revision 1 has been developed into the following specifications and sections. A ministerial roundtable will be hosted by Honorable Minister of Health and Family Welfare, Government of India, on strengthening primary health care as a key element toward achieving universal health care coverage. Next, program budget matters. We'll discuss program budget 22-23, implementation, and midterm review. Program budget 24-25. Draft 14 General Program of Work, JPW 14. Sustainable financing. The next section will cover policy and technical issues. The agenda has 5 topics for discussion. Progress reports on selection of the regional committee resolutions will be presented as part of the reporting timelines of the respective resolutions. Governing body matters commences with nomination of the regional director. Further, it includes elective posts, key issues arising out of the 70 World Health Assembly and 152nd and 153rd session of WHO Executive Board, as well as review of the draft provisional agenda of the 154th session of WHO Executive Board. Next, management and governance matters. Those will cover 3 agenda items, namely status of Sierra Regional Office Building, evaluation annual report, and finally amendments to the rules of procedures of WHO Regional Committee for Southeast Asia. Special program will have 2 agenda items. The delegates may please note that there are updates on the document numbers under the agenda items. Thank you, Chair.
Thank you. The provisional agenda with document reference is now placed before the regional committee for adoption. Are there any comments on the provisional agenda? No. Thank you. Since there are no further comments, I declare that the distinguished delegates are in agreement and the agenda is hereby adopted as per revised document. Excellencies and distinguished delegates, I am pleased to inform you that our region is the leading region on physical activity, and the regional director has accordingly introduced physical activity session during the meeting conducted by WHO. May I now request the WHO Secretariat to provide information on the physical activity sessions and make other announcement, if any.
Thank you, Chair.
Okay.
Yep, me, Dr. Thakspon Thamrangsi, Coordinator for Integrated Health Services. Before we start our short exercise, let me request all delegations to collect your Be Active t-shirt for the morning exercise activity at the exhibition area by this afternoon. For this afternoon, we will enjoy the exercise from the WHO Sierra children with the song 8 Flagships. Please stand up, find a little space around you, and enjoy. Please stand up.
Stand up.
Hello, we are children of the WHO family. Please stand up and follow our moves on this song about Southeast Asia regional flagships. Yes! But do you know how many flagships there are? 10, 100, billion!
Flagships, one region for the health of billion. Sustain, accelerate, innovate and act. Southeast Asia has 8 flagships.
Flagship 1, Flagship 1, make the region be so free.
Flagship flagship 2. We are beating NCTs.
Flagship 3.
Under 5 mortalities. Flagship 4, flagship 4, 4 stronger UFC.
Flagship 5.
Make them our priority.
Flagship 6. Flagship 6.
IHR emergencies.
Flagship 7.
Eliminate NTT. Flagship 8, flagship 8. And we are ending TB. Eight flagships, one region for the health of billions. Sustain, accelerate, innovate and act. Southeast Asia has 8 flagships.
Flagship 1. Flagship 1.
Make the region needle-free. Flagship 2, flagship 2. We are beating NCTs.
Flagship 3.
Under 5 mortality. Flagship 4, flagship 4, 4 stronger UFC.
Flagship 5.
Make them our priority.
Flagship 6. Flagship 6.
IHR emergencies.
Flagship 7.
Eliminate NTT. Flagship 8, flagship 8. And we are ending TB.
Thank you. Bye.
Good. Thank you, Secretary. It is a great opportunity to relax and stretch our body. Let us now continue with our session. Excellencies, distinguished delegates, ladies and gentlemen, let us take up agenda item 5, key address and report on the work of WHO. You will kindly observe that this agenda item has 2 sub-items. Let us first take up item 5.1, Introduction to the Regional Director's Annual Report on the work of WHO in the Southeast Asia region, covering the period 1st January to 31st December 2022. I invite your attention to the document. May I invite Dr. Poonam Khetrapal Singh, Regional Director, to present the report.
Thank you, Chair. Honorable Chair, Dr. Mansukh Mandavia ji, Honorable Vice Chair, Dr. Elia Antonio, Director General, Excellencies, Heads of Delegation, Partners, Participants. Good afternoon and welcome to this, my final report on the work of WHO in the Southeast Asia region. When I spoke to you earlier today, I talked about transformation and highlighted several examples of what has been achieved by our member states. As ever, the report on our work together over the last year spells out these achievements, country by country, in much greater detail. Every single country represented here today has much to be proud of. Our annual report provides a lasting record of the hard-fought gains that make up the daily struggle that is our life in public health. The report is also a testament to the leadership and dedication of the honorable ministers, public servants, health professionals, volunteers in government, in the private sector, and across civil society. The achievements we record are yours. The role of WHO is to provide support wherever and whenever it is requested. I wish to dedicate this report to the devoted and courageous team at the Southeast Asia Regional Office, across Southeast Asia region, who paid the ultimate price during COVID-19. And I would like to name those: Dr. Vidyantu Projo from the WHO Country Office, Indonesia, Ms. Anita Saxena, Mr. Kadu Rangarajan, and Mr. Kuldeep Sharma from the regional office, and Mr. Gagan Sonal from WCO DPR Korea. Their memory will always be honored and remembered by the region. As we meet here today as a region, I would like to take a moment to step back and look at our achievements collectively. Working together as a region, can the whole be greater than just the sum of its parts? I really believe it can. Excellencies, a decade of health in Southeast Asia. It was almost 10 years since the region was declared polio-free. A disease that had haunted humanity throughout history is no longer endemic. We have maintained our polio-free status, and not everyone thought that we would. And now, 10 years on, we find ourselves hesitantly emerging from a pandemic caused by a virus which is unknown just 3 years ago. Polio and COVID, two bookends of the last decade. A year ago, we talked about building back better. A year on, we are still not out of the woods. We need continued vigilance and more genomic sequencing in the face of emerging COVID variants. And we have to come to terms with the more profound impacts of COVID-19. The pandemic has caused social, political, and economic shockwaves across the region. Health budgets are under intense pressure. People's lives and livelihoods are threatened. If we are serious about real health security, by which I mean not just protection from communicable diseases, we and our colleagues across governments still have so much more to do. Governments across the globe are seeking agreements to prepare for future crises, but fresh from witness the limits and fragility of global solidarity, not least when it comes to access to vaccines, we still have no guarantee that the world will act differently when the next pandemic comes. And if it was not evident before COVID, it certainly is now. Crises do not happen one at a time. Public health is a battle with multiple front lines. Excellencies, colleagues, we are working in a fast-changing environment. The world in which we work has changed fundamentally. But before we look to the future, let us reflect on what we have achieved together in the last 10 years. Back in 2014, we agreed that we needed clear priorities. Out of multiple demands from all of the countries in the region, we agreed on 8 flagship programs. These flagships would not prevent WHO responding to country-specific needs as and when they arose, but they would form the core of our work together. In practical terms, they account for around 80% of resource allocation. So, what have we achieved? Today, pregnancy, childbirth, infancy, and childhood in our region are safer than ever. Between 2015 and 2020, the region achieved the world's highest annual rate of reduction of maternal mortality, from 148 to 117 per 100,000 live births. In 2016, we eliminated maternal and neonatal tetanus as a public health problem. 5 countries of the region have already achieved the 2030 mortality rate targets for children under 5 and newborns. Almost all other countries are on track. All member states have initiated hospital-based birth defect surveillance and are implementing national action plans to prevent and manage birth defects. Across the region, fewer children suffer today from measles and rubella. 5 countries have eliminated measles as well as rubella. Overall, the reported incidence of measles and rubella dropped by 75% and 80% respectively. We have achieved path-breaking progress on eliminating neglected tropical diseases, eliminating more than 20 diseases in 1 or more countries over the past decade. The number of people in the region needing treatment of NTDs dropped by 20%, which means around 236 million people. A few examples. In 2015, Maldives was the first country in the region to be certified malaria-free, which Sri Lanka achieved the next year in 2016. Both countries eliminated lymphatic filariasis, followed by Thailand in 2017 and Bangladesh in 2023. In 2016, Thailand became the first country of Asia to eliminate mother-to-child transmission of HIV/AIDS and syphilis, followed by Maldives and then Sri Lanka in 2019. In 2016, India became the first country globally to gain yaws-free status under the 2012 Global Roadmap. And in 2018, Nepal eliminated trachoma, which Myanmar achieved in 2020. 5 countries have the potential to eliminate malaria by 2025. And I'm sure you're aware, last week, Bangladesh became the first country globally to be validated for having eliminated Kala Azar as a public health problem, a tremendous achievement. The battle against non-communicable diseases continues, but the probability of dying from cardiovascular diseases, cancers, diabetes, and chronic respiratory diseases between the ages of 30 and 70 years is just 2% below than a decade ago. The region is currently on track to achieve the WHO NCD Global Active Plan target of a 30% relative reduction in tobacco use prevalence between 2010 and 2025. 6 countries have strengthened food labeling policies, 5 have strengthened taxation of sugar-sweetened beverages, and 3 have adapted regulations to eliminate trans fats, covering more than 1.6 billion people. 9 countries are now implementing the WHO PEN, which helps integrate NCD services at primary level. Over the past 5 years, 10 million more people with hypertension have assessed protocol-based management, almost doubling the rate of control from 26% to 47%. 8 countries have population-based cancer registries, and 5 countries have introduced nationwide HPV vaccination. Antimicrobial resistance continues to be a major public health and development threat, and the region remains the AMR hotspot. But the basics are in place. Since 2018, all member states have been implementing national action plans to address AMR, and our region is the only one in which all countries carry out annual self-assessment surveys. Most member states continue to implement national monitoring systems for resistant pathogens and antimicrobial consumption, and all member states are enrolled in the Global Antimicrobial Resistance Surveillance System. Strengthening emergency risk management has always been an outstanding concern in this region. Based on state-party annual reporting between 2018 and 2020, countries increased IHR core capacities from 56% to 63%. 9 countries have conducted joint external evaluations, and 8 of them have implemented a multi-year national action plan. Most countries continue to implement national action plans for disaster risk management, and all have begun to implement the region's strategic roadmap for health security and health system resilience for emergencies 2023 to 2027. TB was a belated addition to our flagship priorities. It remains a stubborn challenge. Progress in the region determines whether and when the goal to end TB worldwide will be realized. The Southeast Asia region accounts for more than 45% of global TB incidents, more than half of TB-related deaths, and more than 38% of the drug-resistant TB cases. We do not lack declarations of commitment at the high-level country-led meeting in October 2021 in the unanimous adoption of a new regional strategic plan towards ending TB from 2021 to 2025. In the adoption of the Gandhinagar Declaration in August this year, and at the second UN General Assembly high-level meeting on TB last month in New York, several high-burden countries have initiated more people on treatment in 2022 than in 2019. But the challenge remains. If we are honest, ending TB is almost as elusive now as it was 10 years ago. Ladies and gentlemen, universal health coverage underpins all other flagships and SDG health targets. So let's start with the big picture of the 270 million people projected to be covered by UHC over the course of the 13th GPW. 110 million, that is more than 40%, or from our region, that is the Southeast Asia region. What does this mean in practice? First, more people with access to healthcare, the index which we use to measure overall service coverage across the region, has increased from 54 to 62. And less financial hardship. Out-of-pocket spending as a share of total health spending decreases from 43 to 38%, coinciding with a modest increase in public health spending from 42% in 2014 to 49% in 2020. Between 2015 and 2017 alone, the number of people impoverished due to out-of-pocket health spending halved from 12 to 6%. In 2021, the Southeast Asia region became the first to adapt the WHO UNICEF operational framework for PHC to reorient health systems towards quality, accessible, affordable, and comprehensive PHC to achieve UHC, health security, and health-related SDGs. In this region, we also agreed that we had 2 specific areas where we wanted to focus as part of the UHC agenda, which is human resources for health and access to medicines. The region's decade for strengthening human resources for health from 2015 to 2024 has catalyzed lasting gains. The density of doctors, nurses, and midwives in the region has increased by over 30%. Reforms to enhance the quality and relevance of health workers now focus on transformative education geared to UHC. On access to medicines, all member states have updated national medicine policies with a focus on ensuring equitable access to quality medical products. All countries now regularly update national essential medicine lists which guide healthcare resource allocation and rational medicine usage. In this region, policies and training that ensure safe, effective, and evidence-based traditional medicine are a critical element of UHC. In March 2022, WHO and India launched the Global Center for Traditional Medicine, and in August 2023, we co-hosted the first ever Global Summit on Traditional Medicine, which was a tremendous success. Excellencies, the short summary shows that we have much to be proud of. Over the last 10 years, working together across the region, we have made a difference which translates into longer, happier, and healthier lives. But we cannot shy away from the fact that progress in some areas that we all deem to be a priority have been modest at best. Too many health systems in the region are still funded primarily through out-of-pocket spending. In half of the region's countries, more than a third of health spending comes directly from individual households, driven by spending on medicines, especially by the poor, which is not acceptable. It is not acceptable that those who can afford the least still need to pay substantially more. When it comes to government health spending, there has been a small overall increase at 0.8% in the proportion of government budgets allocated to health. Had it been more, the region's strategic and technical excellence, world-leading research and medical institutions, and dedicated health professionals would have been able to achieve much more. As Dr. Tedros repeatedly reminds us, it is a political decision to invest in health, and we in this region could do better. Excellencies, colleagues, I have the privilege of being able to look ahead, having worked in WHO for over 25 years, first as Executive Director in Geneva, and then as the Deputy Regional Director, followed by the Regional Director in the WHO Southeast Asia region. Allow me a few reflections on where we now stand. Crises do create opportunities, but it is important that we are aware of the magnitude of the challenges that we are now facing. I alluded before to the fact that coming out of the pandemic, our region faces major economic and fiscal uncertainties. We have seen the fragility and limits of global solidarity. We have lost ground on shared goals. Millions have been pushed back into extreme poverty. At the halfway point in 2030, nearly all the global SDGs are off track. Food prices remain high, job recovery has been slow and uneven. The climate crisis is a real and present danger to health and to our economies, not a distant threat on the horizon. Geopolitical competition undermines collective action and makes it harder to resolve what may in the past have remained just local conflicts. At the same time, the value and priority people attribute to health and well-being is higher today than ever before. This means increased demand for health services, It means calls for a more holistic approach to health and well-being. It means a more joined up approach to policies that impact on lives and livelihoods. And it means that health and well-being are no longer just nice to have add-ons. When preparing government budgets, they need to be seen as key drivers of the national economy. Looking ahead, let me draw what I see as some key lessons from the last 10 years. First, it is no accident that the two defining events of the last decade were a result of communicable diseases. Eternal vigilance as the price of health security applies to new and emerging health threats, but also those that are still with us. Second, there is no longer any doubt that non-communicable diseases represent a challenge that can undermine much of what we have achieved in public health. A mere 2% decrease in mortality over a decade in this region should be a cause of concern. We have ample evidence about NCD determinants, but a very modest track record when it comes to doing anything about it. The economic, commercial, political, social, and environmental drivers of disease require action on multiple fronts, most beyond the influence of the formal health sector alone. These are political and not just technical challenges. If we are to lead the most important conversation in public health in this region, we must be prepared to work with and influence those that have the power to bring about the change. Third, throughout the pandemic, we have seen the power of science and scientific collaboration. One of WHO's enduring strengths at global, regional, and country level is to bring together the best minds to address any technical challenge. The new frontiers of technology have the potential to revolutionize health policy and practice, but only if they reduce and do not deepen existing inequities. Science must walk hand in hand with access and equity. We must never forget the contrast between the speed of vaccine development and the length of time it takes to fairly share the benefits that it has produced. Advances in artificial intelligence, robotics, and synthetic biology open extraordinary opportunities to accelerate health and well-being for all. But there is no guarantee that they will result in more efficiency or equitable access unless careful thought is given to how progress is governed globally, regionally, and nationally. It is my sincere hope that WHO will step up to lead this dialogue. Fourth, we have become accustomed to working in an increasingly complex and crowded institutional space. The health ecosystem globally and in this region has seen an increase in the number of new players, new partnerships, new platforms, and new funds. We talk about collaboration, but too often we compete for attention and for resources. We must work together, reducing duplication and fragmentation. Our colleagues in other funds, programs, and agencies are our allies. We are on the same side. At country level, this means engaging as one with key partners across government, particularly with ministries of finance. But collaboration cannot depend on country offices alone. We need to incentivize that ensure it is a global and regional priority. If we can, we are to make it as part of our working DNA. And lastly, over the past 10 years, we have learned critical lessons about what works and what must remain as constants in our fight for better health. Above all, the central importance of universal access to the services that people need with financial protection and adequate investment at the primary level. To me, what is vital as we go forward is that this remains a practical agenda. Real people dealing with real issues of life and death, leaving no one behind, is a tough political challenge. But let's face it, more often than not, we know who is being left behind and why. The challenge is to do something about it. Similarly, equitable access means confronting vested interests that will actively resist the change. Unless accountability has consequences, it has little meaning. These are tough issues. They must not just end up as slogans to be repeated in every new declaration. My point, and it is a critical one, is that UHC is only the most powerful concept in public health if we take these practical challenges seriously, matching concepts and good intent with nuts and bolts action. That is the way forward. Excellencies, colleagues, my friends across this region, a chapter ends. The book remains. The story is yours to write. We can be proud of our work together, not just over the last year or even the last decade, but over the past 75 years as WHO celebrates its Platinum Jubilee. But the work doesn't stop. It never will. New challenges emerge, old challenges return. In public health, as life itself, change is the only constant, and agility our only recourse. Together, let us put our faith in the future, in new leaders and new challenges. We are in good shape. We are future ready and self-assured. And so we can look forward for a healthier, more equitable and sustainable Southeast Asia region for all. I thank you.
Thank you, Poonam Singh ji, for a very comprehensive introduction to the annual report. I'm sure that I will be joined by all in saying that the leadership of Dr. Poonam Singh, especially her regional flagship priorities, as well as the many reforms she has undertaken, are exemplary. The year 2022 will be remembered in history as the year of the COVID-19 pandemic recovery. The support extended by WHO to all of us under her magnanimous leadership has resulted in remarkable improvement in building back better health systems, control as well as elimination of disease, improved vaccination, and accelerating towards the SDG indicators and GPW targets. This is very well reflected in the report presented by her. On behalf of all member states, I would like to thank Dr. Poonam Singh for her country-focused approach. Excellencies and distinguished delegates, we will take up the next part of Agenda 5, which is item 5.2, addressed by the Director General. We look forward to vision and guidance of Dr. Tedros, Director General of WHO.
Thank you, Your Excellency.
Thank you.
Chair of the Regional Committee. Can you hear me, Your Excellency?
Yes.
Thank you. Thank you, Your Excellency, and honorable ministers and heads of delegation, and my sister, Regional Director, Dr. Poonam Ketrapal Singh, Excellencies, dear colleagues and friends, good afternoon to you all. And I'm sorry I can't be with you in person, but I look forward to seeing you on Wednesday. I thank the government of India for hosting this year's regional committee meeting and for hosting our regional office. Namaste. And I commend my sister Poonam for her detailed report with so many achievements in the last decade, especially in relation to elimination of rubella, measles, and neglected tropical diseases. These successes are a testament to your leadership, my sister Poonam. Thank you for everything you have done over the past decade to serve the member states and people of the region, and even beyond. You have guided the regional office with a clear mind, a steady hand, and a big heart. I have very much appreciated your dedication, humility, leadership, and friendship. Of course, I will miss you, but once WHO, always WHO, and hope to working with you in another capacity. Excellencies, dear colleagues, please join me in standing to express your appreciation for our regional director, Dr. Poonam Ketrapal Singh. Excellencies, this year we celebrate the 75th anniversary of the founding of WHO. And there is much to be proud of in this region and around the world. But we also continue to face formidable challenges, some old, some new, some technical, some financial, some political. This meeting, therefore, comes at an important time. The United Nations General Assembly in New York this September was a historic one for health, with 3 high-level meetings on health issues. Member states approved strong political declarations on pandemic prevention, preparedness and response, universal health coverage, and tuberculosis. All 3 are relevant to the work of this region, and all 3 depend on a strong WHO and a strong Southeast Asia region. In my address to the regional committee last year, I outlined 5 priorities, the 5 Ps, which are now becoming the basis of GPW14, to promote, provide, protect, power, and perform for health. A few words on each. The first priority is to promote health and prevent disease by addressing its root causes. In the air people breathe, the products they consume, and the conditions in which they live and work. In particular, this means action to address the drivers of non-communicable diseases, including to reduce tobacco use and harmful alcohol, improving diets, and increasing physical activity. And I welcome the Dhaka call to action and the SIA Hearts initiative to enhance prevention and control of cardiovascular disease, which you will consider this week. Promoting the health of humans also means promoting the health of the planet on which all life depends, by reducing emissions to curb air and improve air pollution, and improve health and address climate change. I'm looking forward to COP28 in the United Arab Emirates in December, which for the first time will include a day dedicated to health. I encourage all member states to participate actively, and I use this opportunity to thank UAE that dedicated a day, in a prime day actually, for the first time for health. The second priority is to provide health by radically reorienting health systems towards primary health care as the foundation of universal health coverage. I'm pleased to see that strengthening primary health care as a key element towards achieving universal health coverage has been chosen as the topic for tomorrow's ministerial roundtable. I'm also pleased to note that this region has the highest average availability of data for health service coverage. Those data show encouraging signs of progress in the region, especially in terms of access to health services, which has increased substantially over the past 20 years. In particular, services for infectious diseases have increased dramatically, enabling many member states to eliminate diseases, including rubella, measles, and neglected tropical diseases, as outlined by my sister Poonam earlier in her presentation. I welcome the regional strategic framework on NTDs, which you will consider this week. However, the data also show that as health services have become more available, more and more people are facing poverty or financial hardship by accessing them. Protecting the most vulnerable populations from financial hardship caused by out-of-pocket health spending must be a key priority for all member states. And indeed, Thailand has shown how this can be done, progressively decreasing the proportion of the population who face catastrophic out-of-pocket health spending over the past 20 years. The third priority is to protect health by preparing countries to mitigate health risks and to rapidly detect and respond to both acute and protracted health emergencies. It's now almost 6 months since I declared an end to the global health emergencies of both COVID-19 and Mpox. However, regionally and globally, the same vulnerabilities that COVID-19 exposed persist. During the pandemic, all countries built new capacities to prevent and control epidemics and pandemics. I urge all member states to sustain those gains and not slip back into the cycle of panic and neglect. The investments you have made must not go to waste, nor must the painful lessons we have learned. I welcome the Regional Health Security Roadmap, which you adopted last year, and I urge all member states to continue to implement it as we work together to build a stronger health security architecture regionally and globally. The new pandemic agreement and target amendments to the international health regulations will provide the vital legal foundations for that architecture. I'm pleased to note that the Bureau of the International Negotiating Body has now completed its draft of the negotiating text of the pandemic agreement, which has been circulated to member states. At the same time, I'm aware that there remain differences between member states on critical issues. I'm concerned that negotiations are moving too slowly and that the accord may not be agreed in time for the next year's World Health Assembly. I urge all member states to work with a sense of urgency, with a particular focus on resolving the most difficult and contentious issues, so that we can have the deal by May 2024 as agreed. This is a unique opportunity that we must not miss to put in place a comprehensive agreement that addresses the lessons learned during the pandemic, with a particular emphasis on equity. This is a generational agreement that should be written by this generation with its lived experience of the pandemic. It's our responsibility to protect future generations. Promoting, providing, and protecting health are proposed as 3 key priorities for all member states in the 14th General Program of Work. The other two P's, powering and performing for health, are enablers of the first three. Powering health means harnessing the power of science, research and development, data and digital technologies. I'm pleased to note that data-driven policy making and sharing information on a common platform is on your agenda this week. This has been a key area of work for WH over the past 6 years as part of our transformation. Leveraging the huge potential of digital technologies for health is another key priority. I was very pleased to be in Gandhinagar, India in August to launch the global initiative on digital health at the G20 Health Ministers meeting. And I thank India for its leadership. Not only on this one, by the way, but also on countermeasures and other health issues that were given clear priority during G20's presidency. And I thank the government of India for putting health at the center of the G20 global agenda. The global initiative of this digital will support member states by converging and convening global standards, best practices, and resources for digital health transformation rooted in people-centered, evidence-based solutions. And the final P, performing for health, is about the work we are doing as Secretariat to support you better. As you know, we're now working with member states to develop the 14th General Program of Work for 2025 to 2028. Already, we have had several rounds of consultation with member states, and feedback on the draft outline of the GPW 14 is encouraging. The major thrust of the GPW 14 will be to achieve real change in WHO operations and capacities at country level in the context of a changing world. In practice, this means strengthening our country offices with a core country presence, delegation of authority, adequate financial and human resources, the implementation of global mobility, enhanced internal communications, and more. This initiative is led by the country office heads themselves. To support these efforts, I have squeezed $100 million from our budget to allocate to country offices. Our program budget for the next biennium is also the first in which country offices will be allocated more than half of the total budget for the biennium. We have already increased funding flows to regions and countries, and the more flexible funding we receive, the more we can increase that amount and continue to strengthen our country offices. Our CR regional office is a good model in pushing more resources to the country offices, and I hope this will continue under the new leadership. Our work to strengthen country offices will benefit greatly from the 20% increase in assets contributions and by the proposal for an investment round, both of which you approved at this year's World Health Assembly. Thank you so much for that support. And I'm happy that we are now able to present to you a white paper for consultation with member states on WHO investment. And I'm pleased that financial sustainability will be discussed in this regional committee meeting. I look forward to hearing from you as we work together on this critical goal. We're also continuing our efforts to strengthen our workforce, to achieve gender equity at all levels, and to make zero tolerance for all forms of sexual misconduct a reality and not merely a slogan. While we have achieved gender parity this year, overall on the average, we need to continue to improve, especially in high-level positions like country office heads and director level, where parity has still not been achieved. Excellencies, my thanks again to India for its hospitality and leadership, and to all member states for your commitment to fulfilling the founding vision of our World Health Organization, the highest attainable standard of health for all people. I give you my personal commitment that for the remainder of my time as Director General, I will continue to do everything I can to support you. I will, together with the new regional director, strive to maintain the momentum on the important gains you have made, from disease elimination to building resilient health systems. I look forward to work with you to reach beyond the Ministry of Health to the many other sectors that affect health. I'll continue to push for more financing of health by countries, donors, partners to sustain the gains and accelerate progress. I will make every effort to enhance transparency and accountability at all levels of the organization, while striving to create an agile and fit-for-purpose organization that can serve you better. Thank you all once again for your continued commitment to promoting, providing, protecting, powering, and performing for health in the region. And again, I thank my dear sister Poonam for her leadership and all that she has achieved during her tenure. And we will build on her legacy. I wish you all a very productive and successful regional conference. I thank you. Namaste.
Thank you, Dr. Tedros. Excellencies and distinguished delegates, the Director General has provided useful and welcome guidance to member states of the regions to further strengthen their COVID-19 pandemic response, maintaining essential health services, health systems, development efforts, emergency preparedness, as well as their planning for future collaboration with WHO. Dr. Tedros has made it clear that WHO's contribution in arena of public health is inevitable. His message has illustrated that how WHO's contributions would lead to eventual impact at the country level, especially in line with the SDG targets, the strategic priorities, and the triple billion goals. Excellencies, distinguished delegates, and participants, in accordance with the Rule 11 of the Rules of the Procedure of the WHO Regional Committee for Southeast Asia, adherence to time while making intervention is desirable. On the same lines as seen during the World Health Assembly and the Executive Board, we have observed that timekeeping through traffic light system helps in efficient utilization of time. I wish to inform you that the traffic light will be green for the first 9 minutes and will turn amber for the last 1 minute and will turn red once the allocated 10 minutes are over. I advise and urge the Honorable Ministers and Heads of Delegations to complete their intervention within 10 minutes. I now invite the Honorable Ministers and Head of Delegations to raise their flags. Yes. First we start to Timor-Leste.
Honorable Chair, Director General Dr. Tedros, Regional Director Dr. Poonam Khetrapal Singh, Excellencies, distinguished delegates, ladies and gentlemen. Timor-Leste delegation takes pleasure in presenting compliments from the governments and the people of Timor-Leste to the 76th Regional Committee session of WHO, Southeast Asia region, and thanks the Minister of Health and Family Welfare, Government of India, and hosting the Regional Committee meeting. My delegation commends and applaud Regional Director Dr. Poonam Singh for visionary leadership as she eloquently presented the excellent work and comprehensive progress the Southeast Asian region has achieved not for 2022, but over the last decade. It's a result of your farsightedness on bringing 8 regional flagship priority programs that guide us at the North Star, which sustains, accelerate innovation vision as a CAP country as the center of your work, and ensuring substance resources are made available for these mutually identified priorities. The report provided details of achievement, challenges, and the next steps across country and regional flagships, and provokes us to reflect as our countries, the region, and world are slowly recovering from devastating pandemic, but continues to feel the pressure of ongoing and escalating conflicts and wars. As a country that have achieved its independence only 2 decades ago, and a health system that is still developing, last 2 years strengthened our health resources like never before. But a country united by strong people, a started new government, and relevant partners like WHO, we are scaling up efforts in quick time to limit the damage. With support from WHO and partners, not only manage the COVID-19 pandemic, but COVID-19 vaccination, coverage reaches, and all the time hires and routine immunization research were maintained. Universal health coverage is the holy grail of the global health as an attempt to meet the USC targets health services have priority the delivery of integrated health services in Timor-Leste, recognizing PSC as the cornerstone for USC and the health-related SDG of the National Health Day. I dedicated to the nation our integrated package of primary healthcare services designed into the individual and family health inspired by paradigms of people-centered services. This is drawn from the essential service package of primary healthcare development with WHO technical support, an integrated package of the health services and delivered through network community health workers supported by mobile health teams of specialists and health facility will revitalize and update our commitment to provide high quality primary care close to where family live, work, play, and mix. Not only for this, Timor-Leste now have developed the essential service package, the secondary and tertiary care, one of the only 5 countries in the world to achieve these historic milestones. That is a great achievement, and the great achievements come great expectation. As we focus our resources to implement this commitment to our people, I look forward to the trust support of WHO partners because alone we are strong, but together we are stronger. It's partnership that has enabled us to have eliminated polio, maternal, and neonatal tetanus, measles, and rubella, and I count on this collaboration that I will crucial the delivery of the government's commitment to be achieved certification of malaria elimination, elimination of tropical disease such as lymphatic filariasis and yos, in accelerated efforts to the NSTV, introduction of new vaccination as a SPV vaccine by early next year, or sustains high childhood immunization coverage and scale up high quality NCD and mental health services across all municipalities in Timor-Leste. Chair Excellencies, ladies and gentlemen, this will only be possible by securing our health system against future man-made and natural disaster, something that some small island states like Timor-Leste are particularly vulnerable to, and this where strengthening health security for better resilience to future emergency is so crucial. Using the opportunity offered by the crisis of COVID-19, we have massively scaled up our surveillance human capital and our laboratory capability, and we have launched an enlarged and ambitious program to totally upgrade our capacity in critical care emergency services. With support from WHO, we are introducing critical care units in all our referral hospitals and strengthening the competence and infrastructure of emergency services. And thanks to Dr. Punham, we are stabilized state-of-art simulation and skills center in all our regional hospitals and major training centers. To achieve these ambitious targets, we need a quality workforce that is well-motivated, safe medicine and adequate quantity, and integrated health information system that is complete, timely, and accurate. along with inaccurate financings. Dr. Singh, you also raised the challenge of climate change and the small island developing state. This threat is quite real for us. That's why we speak of Build Forward Better, which is creating greener, safer, and healthier environment with our efforts of greening the health sectors. Clearly, there is so much to be done, and we cannot do it alone. As my minister focused on this priority, I count on continued support from WHO regional and country office to meet these challenges by important targets. As we take this journey together, we need WHO to continually guide and support us. Dr. Punham Katrapang Singh, Regional Director, CRO, has done this over a decade by keeping country at the center of her work and extends our congratulations as we again acknowledge your vision of sustains, accelerate, innovated, and implemented the flagship priority. We strive for a better, safer, greener, and more equitable and resilient health system. Together, we can. I thank you and obrigada, Bharat.
Thank you, Your Excellencies. Now I request Secretary Health, Bhutan, for their intervention.
Excellencies, heads of delegations of member states, Dr. Tedros Adhanom, Director General WHO, Dr. Poonam Khetarpal Singh, Regional Director, WHO Southeast Asia Region, distinguished delegates, ladies and gentlemen. My delegation from Bhutan would like to extend our warmest greetings from His Majesty the King and the people of Bhutan to the 76th session of the WHO Regional Committee for Southeast Asia region. At the outset, I would like to thank CRO for the opportunity in organizing the 75th session of the RC in Bhutan last year. It is regretted that Health Minister Dasho Dichen Wangmo, the chair of the 75th RC, could not join us as a 5-year term of the government ends today. I convey our respects and best wishes to the chair and members of the 76th RC. May I acknowledge Dr. Tedros, the Director General of WHO, who has joined virtually for the 76th RC meeting. Your presence indicates the importance we accord to the regional committee meetings in taking forward the regional health development agenda to a higher level. I offer my congratulations to Honorable Minister, Ministry of Health and Family Welfare of India for assuming the chairmanship, and the Honorable Minister of Timor-Leste for assuming the vice chairmanship of the 76th RC. Excellencies, distinguished delegates, Bhutan welcomes the Regional Director's Annual Report for the period of 1st January to 31st December 2022 and commend the progress and achievements of WHO's work in the Southeast Asia region under Dr. Poonam Singh's leadership. We recognize significant health achievements in the region that have greatly contributed in meeting the global health outcomes in spite of competing health priorities and ever limited resources. Bhutan would like to assure our full commitment and collaboration to take forward the priority health agendas of the region. Excellencies, distinguished delegates, let us pause and commend our regional director's leadership of WHO Southeast Asia region over the last 10 years. Your exceptional leadership has been instrumental in achieving significant milestones in the health sector, combining technical prowess, adept managerial acumen, and diplomatic skills. Your contribution to regional and global initiatives, along with your exceptional work in placing health at the core of sustainable development, have propelled our region to new heights. As the first woman to assume the role of regional director, your dynamic leadership in a region that encompasses 1/4 of the world's population with a disproportionate burden of diseases has been extraordinary. Your unwavering dedication has fostered collaboration with all member states, facilitating the delivery, safeguarding, and enhancement of our region's health. You tirelessly consulted member states on their priorities and hence developed a series of flagship priority programs that are pursued with tenacity, high-level resolve, and significant success. With a vision to have impact on ground, you have always given priority to countries in terms of financial and technical support and allocating more than 80% of the funds to country offices. Under your guidance, health emergency financing has consistently provided timely and essential financial support to member states during emergencies that has not only been a lifeline but also a beacon of hope, enabling effective emergency management. Under the measles and rubella flagship, with your guidance, Bhutan achieved a significant public health milestone by eliminating both measles and rubella during your tenure. Excellencies, distinguished delegates, ladies and gentlemen, Bhutan is on a path to achieving universal health coverage through strengthening primary healthcare programs, thanks to WHO's guidance in shaping our health policies and strategies. The Paro Declaration on Mental Health is a milestone that has been commended during United Nations General Assembly side events. Bhutan's exemplary response to the COVID-19 pandemic is a testament to the strategies and resources made available through Southeast Asia Region Health Emergency Fund. With WHO's partnership and equitable vaccine distribution through COVAX, we have vaccinated 98% of our population, ensuring safety and well-being. Excellencies, distinguished delegates, ladies and gentlemen, I regret that time does not allow me to fully enumerate the extensive contributions the regional director have made to the region. However, what we can confidently assert is that we have left an indelible footprint for others to follow, and your legacy will serve as an enduring inspiration to those who continue this vital work. As we recognize the end of our term as regional director, we do so with deep gratitude and profound respect. You have set a standard of excellence in global health leadership that will be a guiding light for generations to come. We are honored to have been part of your journey and look forward to continuing the work that you have pioneered, inspired, and championed. I thank you and Tashidul.
Thank you, Excellency. Now I request His Excellency Mr. Ahmed Nasim, Honorable Health Minister, Maldives.
Thank you. Thank you, sir. Ladies and gentlemen, dear colleagues, and esteemed chair, my delegation and I extend our heartfelt gratitude to the regional director and her office for the comprehensive report. As in previous years, this report has adeptly encapsulated the events of the past years in our region and countries, while delineating the key priorities and actions that lie ahead. It invariably sets the tone for our deliberations during this 76th session of the Regional Committee. Over the past decade, the collaboration between member states and the WHO at both country and regional levels have grown stronger. Thanks to the able leadership and stewardship of our Regional Director, Dr. Poonam Khetrapal Singh, the positive health outcomes that our countries enjoy are testament to the invaluable cooperation, synergy, and concerted efforts between WHO and our governments. I would like to take a moment to share some key points from the Maldivian perspective on the report. The regional office, in partnership with member states, has developed a draft regional strategic framework to address the neglected tropical diseases. We encourage all member states to vote in favor of its adoption at this regional committee, which has happened now. The regional director's flagship areas have been remarkably impactful. The emphasis placed on these priority areas and the allocation of resources have proven to be a game changer. In Maldives, these flagships, coupled with WHO's leadership at the regional and country level, have been instrumental in achieving our health targets, including the early elimination of measles and rubella. Most recently, the achievements of numerous islands to be declared free of leprosy. Our commitment to end tuberculosis by 2025, with the establishment of 100 TB-free islands by the end of 2024, reflects our dedication to tackling this critical health issue. Furthermore, our efforts in maternal and child health have kept mortality rates lower than global and regional averages. We are also making strides in other flagship areas such as antimicrobial resistance and health emergencies. The pursuit of universal health coverage is central to our efforts. Ensuring access to health services without financial hardship is paramount, and we have achieved most of our UHC targets with a focus on human resources and essential medicines. The recently initiated primary healthcare revitalization program, guided by WHO, is a driving force in achieving and sustaining our UHC outcomes. The rise of non-communicable diseases and mental health issues in Maldives has prompted us to focus our PHC model on addressing NCDs like cardiovascular diseases and cancers, alongside their risk factors. We are aligned with Dr. Tedros' emphasis on a primary healthcare approach for achieving health gains. The primary healthcare model piloted at Faf et al. Demonstration site stands as a testament to the crucial takeaways essential for reorienting health systems to primary healthcare. Firstly, it underscores the imperative need for sustainable funding, serving as the lifeblood to reshape healthcare structures. This funding is pivotal not just for reorienting health systems, but also for expanding the health workforce. It emphasizes the significance of quality education, fair compensation, proper equipment, and decent working conditions for healthcare professionals, ensuring that they are equipped to deliver optimal care. Secondly, Faf et al.'s model vividly illustrates that primary healthcare extends far beyond the confines of our health facilities. It encompasses a comprehensive approach that integrates health promotion, disease prevention, rehabilitation, and palliation. Moreover, it fosters robust links with public health initiatives, emphasizing the interconnectedness of various health facets and the need for a holistic healthcare strategy. This holistic perspective reflects a fundamental shift in healthcare philosophy, emphasizing preventive measures and community well-being alongside curative treatment, ultimately leading to healthier and more resilient communities. Additionally, it prioritizes equitable access to healthcare, particularly for marginalized and vulnerable populations. It is essential to engage political leaders at all levels to lead this effort effectively. Further to that, the stark reality of climate change's disproportionate impact on both health and livelihoods was glaringly evident at this year's SIDS Ministerial Conference on NCDs and mental health. The situation is dire, with predictions indicating an exacerbation of these effects in the near future. Globally, nearly 7 million premature deaths occur due to air pollution. Moreover, adverse events linked to climate change, such as water shortages, food scarcity, heat waves, the spread of vector-borne choleric diseases, and the crumbling of health infrastructures are becoming alarmingly common. As a country, it is a remarkable achievement itself that being a country with no fresh water, all the residents of Maldives enjoy the safety and benefits of fresh and clean water in all the islands. The impact of such multi-sectoral developments are seen not only in our health sector achievements, but also enjoyed in socio-economic context as well. Despite Maldives' commendable investments in mitigation activities such as greening the health sector and adopting renewable energy resources, the challenges persist and many threats lie beyond our shores. The ongoing research on the impact of microplastic on human health mirrors the urgent need for comprehensive action. As WHO's Dr. Maria Neira emphasized during the Population Health and Development Congress in Egypt this year, the only viable solution is to close the tap and staunch the flow of pollution and waste into the oceans. Underscoring the imperative for global cooperation and concerted efforts to mitigate these disastrous consequences of climate change. On that note, I commend WHO's leadership in pushing the climate health agenda and making our voices heard through COP28 declaration on climate and health. Before I conclude, I would like to say a few words to my friends and partners in crime, Dr. Tedros and Dr. Poonam. Dr. Tedros, your tenure as the Director General of the World Health Organization has not been easy. We know that. It has been riddled with worldwide catastrophes, wars, endemics, and worldwide pandemics, and devastating consequences of climate change. However, you are handling it with admirable grace and compassion. You are a true example of kind leadership, and I thank you for always returning our calls and responding to our messages, no matter the complexity or the hour. And finally, to my dear Dr. Poonam, thank you very much. I was plunged into a chaotic wave of health ministership at the peak of COVID-19 in Maldives. However, Dr. Poonam's calm disposition and her no-nonsense guidance kept me afloat. Amidst all the deaths and tragedy, I must say, I am certain that her leadership, contributions, and dedication will remain a powerful legacy to our region and other regions for generations to come. You may know this, Your Excellencies, you may not know this, Your Excellencies, but this may be the last political and diplomatic engagement of my career. That it coincides with Dr. Poonam's last regional committee is a matter of great joy. Dr. Poonam and I have had many discussions about our retirement and the big after. One remark she said in passing has remained with me. She said, our posts may come and go, but relationships remain everlasting. Thank you. Thus, Your Excellencies, let us ensure that our relationship with each other remain not only everlasting, but also ever joyful. To conclude, Maldives reaffirms our commitment to working with our colleagues and fellow member states. With our collective efforts, let us ensure that our world remains a safe and habitable place for our children, grandchildren, and coming generations. With our collective efforts, let us harness the power of primary health care to achieve better health for our countries and the region. My appreciation to all ministers, delegates, and especially to our regional office. Thank you very much.
Thank you, His Excellency. Now I request Dr. Sairifa Lija Munira, Indonesia.
Thank you. Thank you, Your Excellency, Dr. Mansukh Mandavia as Chair, and for organizing such an outstanding 76th Regional Committee meeting. Dr. Tedros, Director General of WHO, Dr. Poonam, Regional Director of WHO CRO, Your Excellencies, ladies and gentlemen, Indonesia would like to acknowledge and appreciate the annual report of the World Health Organization in the Southeast Asia region, presented by Madam Regional Director for 2022. The past year, marked by both challenges and opportunities, has seen us come together as one region. This is definitely something to appreciate and no easy feat, and is evident of the leadership of Dr. Poonam as Regional Director and Dr. Tedros as Director General of the World Health Organization. In line with the World Health Organization's vision for universal health coverage, Indonesia continues its unwavering commitment to strengthening healthcare systems, enhancing disease surveillance, and promoting health equity. We have achieved significant milestones in improving health outcomes for our citizens despite the ongoing global health challenges. The period under review has also brought to light the resilience and adaptability of our region in the face of unprecedented health crises, natural disasters, and social changes. Indonesia remains steadfast in our commitment to disaster preparedness, response, and recovery, thus contributing to the broader regional efforts in disaster risk reduction. As our high-level commitment during United Nations high-level meeting on pandemic prevention, preparedness, and response, we would like to highlight 3 points. One, that we must strengthen the global surveillance network. Indonesia has made significant strides in enhancing our surveillance capacities. 2, we must strengthen capacities of research, development, and manufacturing of vaccines, therapeutics, and diagnostics globally. Indonesia is expanding our vaccine research, development, and manufacturing capacities. 3rd, we must increase commitment to strengthen financing for PPR efforts. Under its presidency in G20, Indonesia has spearheaded the establishment of the Pandemic Fund. It is with the understanding that pandemics can happen at any time, so we must be prepared and prepared sufficiently. Furthermore, we acknowledge the invaluable support and collaboration with the WHO CRO, as well as our regional counterparts within the Southeast Asia region. The spirit of cooperation and shared responsibility has been instrumental in overcoming the myriad challenges faced by our region. We embark on this journey of reflection and progress. We remain dedicated to ensuring that the health and well-being of our region are upheld as a top priority. We look forward to the invaluable insights and experiences shared within this report, as they will be undoubtedly guiding our future endeavors. Indonesia once again would like to extend our highest appreciation for Dr. Poonam's dedication and tireless efforts to the public health in the region and globally. Thank you.
Thank you, Indonesia. Now I request my colleague Manasvi Kumar to present India's intervention.
Thank you, Chair. Excellencies, distinguished guests, namaste and a very good afternoon to you all. I would like to express my heartfelt gratitude and appreciation for the opportunity to share my thoughts with you. At the outset, I congratulate the WHO for bringing out a lucid annual report that comprehensively assesses the health status of the member countries of the Southeast Asia region. This report serves as a valuable resource, shedding light on our collective journey towards achieving universal health coverage and marching towards the Sustainable Development Goals for attainment of good health. This report shall be instrumental in guiding our efforts and policy decisions, allowing the countries to make informed choices for the betterment of healthcare and well-being in the region. Excellencies, I would also take this opportunity to highlight the landmark initiatives that India has undertaken to strengthen its health architecture and which has brought about a paradigm shift in the provisioning of healthcare. The epidemiological shift of disease burden from communicable to non-communicable diseases has become a significant and important global health challenge. India is also experiencing rapid epidemiological changes with a steep rise in NCDs. To address this challenge, India has rolled out a population-based initiative for prevention, control, and screening of NCDs. Under the initiative, persons more than 30 years of age are targeted for their screening. Screening of these common NCDs is an integral part of service delivery under the Ayushman Bharat Health Scheme, a comprehensive need-based healthcare service. Transitioning from a sectoral and a segmented approach to health service delivery, India launched the flagship program Ayushman Bharat in the year 2018, built on the principles outlined in the National Health Policy that was envisaged way back in 2017. This initiative aims to provide comprehensive, people-centric, need-based healthcare service aligning with sustainable development goals and the pursuit of universal health coverage, underscoring the commitment to leaving no one behind. Under the Ayushman Bharat, over 170,000 Ayushman Bharat health and wellness centers provide an expanded package of services like screening and management of non-communicable diseases such as hypertension, diabetes, and a couple of common cancers, as well as other primary healthcare services for mental health, ENT, ophthalmology, oral health, and palliative care. The Pradhan Mantri Jan Arogya Yojana, the second component, stands as the world's largest health insurance scheme. It aims to provide a health cover of rupees 5 lakh per family per year for secondary and tertiary care hospitalization, including NCDs, benefiting over 12 crore near, poor, and needy vulnerable families in the country. The Ayushman Bharat Digital Health Mission is the third component, which serves as the backbone for achieving universal health coverage. This mission creates a seamless online platform leveraging technology to reach the last mile. The fourth component, the Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, plays a crucial role in filling critical gaps in health infrastructure, surveillance, and health research. Excellencies, India has taken a proactive role in addressing the global public health challenge presented by communicable diseases as well. India has made a resolute commitment to eliminate TB from India by the year 2025. In light of this, Pradhan Mantri TB Mukt Bharat Abhiyan was launched to provide a supportive environment for TB patients. The Southeast Asia region has made significant progress in the battle against various infectious diseases, including HIV and malaria, as highlighted in the WHO's annual report. I applaud the member states on this progress. India aims to foster collaboration and stronger alignment to address the shared challenge, ultimately contributing to global health and well-being. India has undertaken a multi-sectoral approach to deal with challenges of the health sector. In line with our civilizational ethos, India prioritized traditional medicine and the practice of yoga for holistic health and well-being. Since 2014, the WHO regional flagship priority programs have played a critical role in India's public health planning, helping to align our strategic focus with the Global 2030 Agenda for Sustainable Development and other key frameworks, targets, and goals. In this regard, I also extend my heartfelt appreciation to the Regional Director for her leadership and stewardship on disease elimination and universal health coverage, specifically, which very much aligns with India's national health priorities. Excellencies, under the dynamic leadership of our Honorable Prime Minister, Shri Narendra Modi ji, the unanimous adoption of ambitious, inclusive, and action-oriented G20 New Delhi Leaders Declaration during the G20 Leaders Summit in September 2023 is a historic moment for India. The NDLD has facilitated significant alignment between developing and developed nations, amplifying the representation of the Global South. India's G20 health deliverables, the Global Initiative on Digital Health launch, and the establishment of the Interim Medical Countermeasures Mechanism exemplify this. In this context, my gratitude extends to the World Health Organization for its invaluable and humongous support in realizing these deliverables. Excellencies, embracing the ethos of one Earth, one family, one future, India underscores the critical need for nations to join forces and exchange insights. These highlights the interdependence of global health and promotes a collaborative approach when countries unite to address complex health challenges. Essential components of this cooperative and collaborative effort include all vital aspects of global health, such as collaborative research, disease control, capacity building, and policy development. I firmly hold the belief that through concerted efforts and the exchange of expertise, we can improve global healthcare access, improve outcomes, and enhance overall well-being. Thank you. Jai Hind. Dhanyavad.
Thank you, India. Now I request His Excellency Mr. Mohan Bahadur Basnet, Honorable Minister of Nepal.
Honorable Chair, Excellencies, Regional Director, distinguished delegates, ladies and gentlemen. On behalf of the delegation, I would like to express my sincere thanks to the Regional Director, Dr. Poonam Chetrapal Singh, for her excellent leadership in guiding the region to identify and address most critical health issues and driving the global health agenda during pandemic despite huge challenges in the region. The government of Nepal is thankful to WHO for continued technical support in maintaining essential healthcare services, responding to pandemic, strengthening health systems, and accelerating progress in targeted public health priorities and regional flagships. The WHO Southeast Asia region has made considerable progress in sustaining key public health gains, accelerating harmonized emerging health sector needs, and adopting innovative approaches. There has been progresses in many of health sector indicators, including control of communicable diseases, preparedness of public health emergency, and reduction of maternal and under 5 mortality. Honorable Chair, Nepal has recently endorsed National Health Sector Strategy and Health Financing Strategy as guiding key roadmap based on learning from federalism and COVID-19. The primary healthcare outlets have been expanding at the community level in the country with aim of universal health coverage for equitable access to equality health services. We have achieved remarkable progress in improving health status of our citizens, particularly life expectancy, child survival, maternal health, and control of infectious diseases. Despite these progresses, we have many challenges in front of us, which demands strong networking, collaboration, and common understanding among member states of WHO. Equitable access to quality health services and medical products, management of health workforce, reduction of out-of-pocket expenditure, strengthening of integrated surveillance system, and climate change resilient health system are key issues which need continued innovations. The Ministry of Health and Population looks forward to continued support from WHO in health sector priorities as we jointly work on accelerating universal health coverage for equitable access to quality health care. This year, regional committee meeting is very special to all member states as we are electing new regional director for our region. I believe common priorities for this region and country-specific needs will be addressed strongly with the joint efforts. With this note, Nepal team endorse the annual report presented by the regional director. Thank you. Namaste.
Thank you. Now I invite Excellency Dr. Sita Arambe Pula, Sri Lanka, for her intervention.
Thank you, Chair, Vice Chair, Secretary, Director General, Regional Director, and honorable delegates. Dear Dr. Tedros, thank you for your visionary speech, and Sri Lanka avails this opportunity to thank you and the WHO Secretariat for all assistance received during this difficult period to ensure that we don't fall back on the gains achieved. Sri Lanka appreciates you for your steadfast and continuous guidance, evidenced by the report, which has continuously illuminated way forward, not only for our region, but especially setting the stage to build back better and strengthening health system resilience. Dear Dr. Poonam, as the regional director, you at the helm of our region has steered us forwards to achieve many regional and country goals through regional flagships, which align well with global targets and country priorities. The determination to work in concert until all countries achieve the targets via creating political advocacy and commitments such as the Ministerial Roundtable for prioritizing timely needs such as the strengthening primary health care as a key element towards achieving universal health coverage, creating platforms for sharing of experiences by countries, the Primary Healthcare Forum providing guidance in policy and technical matters, especially important for the regions such as regional strategic frameworks like NTDs, neglected topical disease, and also monitoring the progress regularly and revitalizing the momentum as in the school health program. As we have come to realize the reciprocity of health and economics and the magnitude of economic challenges faced by governments, especially during the pandemic period and post-pandemic recovery period, appreciate all consideration of new insight as well as strategic consideration involving to identify and invest in the most cost-effective and efficient methods to increase overall health and well-being. Removal of safety nets, which has exacerbated issues with coping mechanisms, increased out-of-pocket expenditure, heightened food insecurity, highlights the need for targeting the most vulnerable and importance of ensuring equity, while thanking for the comprehensive report and diverse agenda. We look forward to all the insightful interventions. Dear Madam Mardi, Sri Lanka is facing a unique yet critical situation where innovative strategies are needed to sustain the already achieved gains. We face human resource issues due to brain drain, which needs a collective solution, and also propose pooled purchasing of medical products to resolve issues relating to medical products. Although I thought of ending my intervention here, I will have left many thoughts unvoiced if I don't voice our feelings of the delegation and people of Sri Lanka. For the past decade, you have been a mother to our region, guiding, protecting, encouraging, listening, caring, uniting, focusing, and could go on. It would take more than a day to explain in plain sight if I went into the details. We have grown so familiar and appreciative of you and will miss you dearly as you bring us closer to a decade of dedicated period of service as the regional director. We are deeply saddened. I hope you will continue to be a smiling lady that you have been, blessed by all thousands who benefited under the wings of you guiding care. An enormous thank you from Sri Lanka. Aibowan means long life. Thank you.
Thank you, Your Excellency. Now I invite His Excellency Mr. Cholan Sikwe, Minister of Republic of Health, Royal Thai Government. Thailand, please.
Excellencies, Madam Adi, distinguished delegates. My minister has parliamentary meeting today, so he's regret not able to present today, but he will be reaching New Delhi tonight. Thailand welcomes 2022 annual report by RD. RD, during your 10 years tenure, you have made SIA the pride of the WHO. I repeat again, the pride of the WHO. This was clearly evident as your flagship bear the fruits. SIA has been certified and sustained polio-free since 2014. Various NTD were limited in 6 out of 11 member states, including elimination of measles and rubella, filariasis, trachoma in several countries. SIA is the second region to eliminate maternal and neonatal tetanus in 2016. Maldives and Sri Lanka were certified malaria-free since 15 and 16, respectively. So these are the significant achievements for the World Health. On primary health care in USC, India introduced health and wellness centers nationwide, paving the road to improve access to care to health services by massive population size. Indonesia has gone through major health transformation, strengthening PSC as a key foundation for access to care by all JKN members. Timor-Leste, Maldives, both on the path towards extending primary health care to atoll and to smaller geographical catchment area. Thailand has a mature 2-decade USC with favorable outcomes. The Southeast Asia Decade for Health Workforce Development contributes significantly to improve health workforce density in member states in this region, and has been a foundation for primary health care and USC implementation. Although our distinguished colleague from Sri Lanka just said about the international brain drain, so that we have to address further. The adoption of regional strategy on primary health care, the forum, the Dhaka SIA Heart Declaration to be adopted in this RC are two foundations in addressing NCD. We note the improvement of Aisha core capacities through SPA. We note implementing JEE in a number of countries with improvement of their capacities. Further, in 2017, the National Action Plan on EMA was developed in each of the SIA countries, though we felt that further progress has yet to be accelerated. Despite these fruits, challenge remain. Ending TB continues to be a major challenge requiring triple efforts, as RD you have highlighted. We have to work harder to address NCD. Not only diagnosis and treatment, but address the root cause, the commercial determinant of health. Through the application of best by intervention as recommended by the WHO, despite the resistance from commercial actors. We cannot underestimate the resistance by commercial actors that continue interference to policy, especially when government want to increase tax and retail price and control of availability of tobacco and alcohol. To increase financial risk protection in USC, which is SDG 3.8.2, the prevalence of catastrophic health spending, country needs to expand the cost-effective benefit package and increase government funding. At the same time, member states need to produce the prevalence of unmet healthcare needs as called for by the WHO 76.4 resolution and the recent UN General Assembly high-level political declaration on USC. Very unfortunate that the Global Monitoring 2023 on USC Progress 381 and 382, that USC Service Coverage Index has been stalled. Not much progress in the last 15 years, and increased prevalence of catastrophic spending. Even in countries with high level of population coverage, that means government has not spent enough money to address health need and health demand of the population. Madam Adi, Thailand will convene USC conference annually from this year until 2030, not only to commemorate International USC Day, but to review and improve the performance of USC until 2030 and share experience to member states in Southeast Asia. Chair, continued spread of infectious disease, outbreak of dengue in our region. H5N1 virus are circulating in birds and wildlife every day. I note in the US, in Europe, H5N1 circulate in livestock, in birds, in that can one day transmit to human through poultry, from poultry through swine. Therefore, we need stronger capacity on pandemic preparedness, prevention, and response. I strongly urge all member states from Southeast Asia fully engage in the INB, inter-negotiating body, for the negotiation of the pandemic agreement next week and continue in December and February and March. I thank Indonesia and Thailand who support the work of WGIHR by Indonesia and Thailand on INB Bureau represent Southeast Asia. Hopefully, both the amendment, as Tedros has said, of IHR 2015, 2005, and the pandemic agreement will be adopted by next May 24. So what are the two key contributing factors to this success? Sustainable government leadership and commitment towards PSC and USC, health workforce and governance, this is for sure. Second is continued support by WHO CRO. Thailand sent a strong message to the upcoming new RD to be elected by Wednesday this week to sustain the gains and to accelerate rapid progress. We have to, together, work with the WHO and partners and government to write the new chapters of health development in the region. RD, in conclusion, I reiterate what DG has said. You have made SIA the pride of the WHO. Thank you, Chair.
Thank you, Excellency Dr. Viroj. Now I request Excellency Mr. Zahid Malik, Bangladesh.
Thank you, Chair. Honorable Health Ministers, Director General Dr. Tedros, Madam RD Dr. Poonam Khetrapal Singh, Excellencies, colleagues and friends. Assalamu alaikum and good afternoon. This is an honor and privilege for me to speak in this 76th Regional Committee meeting in New Delhi. I express my gratitude for the kind hospitality by the regional office and the Government of India. It is a wonderful feeling for us after a long time, more than 3 years, that we are meeting face to face in New Delhi in regional office. Due to the COVID-19, we couldn't meet and we couldn't exchange ideas and experiences. Now, as the COVID is under control, so it is a nice feeling that we are here again. Everything seemed helpless and hopeless, but with the dynamic leadership of DG of WHO, Dr. Tedros Regional Director, Dr. Poonam Khetrapal, and a strong collaboration of member states, contribution from development partners have helped us to overcome the worst pandemic in our lifetime. In the time of need, technical support and health advices over and above vaccine delivery by WHO has played a crucial role in overcoming COVID-19. Along with these aspects, governments and its people took necessary measures to treat and vaccinate respective people of their countries. Bangladesh has also successfully controlled COVID, treated its patients, and also provided 370 million doses of vaccines to its people free of cost. COVID has also forced us to improve our hospital system. We have 120 central oxygen line, which was not there before COVID. The lab facilities were poor, but now we have all the major hospitals have lab facilities. And now 160 RT-PCR labs are working in Bangladesh, only in the government hospitals. We have also increased our manpower during the COVID period. We employed 15,000 new doctors, 25,000 nurses, and more than 20,000 support staffs. During COVID, we also used telemedicine very effectively, which saved our doctors and patients from getting infected and also saved a lot of time. In Bangladesh, community clinic has been a success. Just to say a few words on the success of Bangladesh. Community clinic has been a success, which has been the brainchild of Prime Minister Sheikh Hasina, and it has been recognized by the UNO in the last UNO General, which has been called Sheikh Hasina Initiative, which can be replicated in other countries also. So in the primary health care is very important to prevent the diseases that we are having now. The communicable disease in Bangladesh has been under control. We are proud that Bangladesh is now free from polio, tetanus, and recently filariasis. And the last one is the Kala-Azar elimination, which is the only country in the world. And for that, we also thank our regional office and Dr. Poonam Khetrapal for her contribution in the elimination of this communicable disease in Bangladesh. Bangladesh has also successfully controlled TB cases, HIV cases, and malaria is also under control and nearing. We expect to eliminate those well before the SDG target. Maternal mortality rate has been reduced quite a lot, and that is, it was 65 a decade back, now it is 28 per thousand. And mortality rate of mothers has reduced from 320 to 155 in Bangladesh. Nutrition has also improved quite a lot. The stunting was, it was 50% at just a decade back. Now it is less than 20% in Bangladesh. EPI has played an important role in Bangladesh in longevity, which is now 73 years in Bangladesh, and now it is 90. In some cases, it is 98% coverage in Bangladesh. Non-communicable disease is on the rise in Bangladesh, as it is all over the world. We are establishing 8 hospitals in Bangladesh in 8 divisions to treat cancer, kidney, heart, total about 4,000 beds altogether. And also, we have set up a non-communicable disease center in all of our district and sub-district level. We have also given quite importance to digital health side. We are digitalizing our entire health system, and through that, as we have experienced the telemedicine importance, so we are digitalizing our entire health system, and which will save time, monitor, and also supervision will be much improved. In Bangladesh, we have recently started, just about a month back, HPV vaccine, which will save our girls from this cervical cancer, through which in Bangladesh about 6,000 women die every year. And in Bangladesh, the pharmaceutical industry is doing quite fine. We meet our entire country requirement through the local production. We have got some challenges also in Bangladesh. Our out-of-pocket expenses is still quite high. It is around 40%. Our NCD is also rising, which is the cause of death of is 67% due to non-communicable disease in Bangladesh. And also, we have got shortage of skilled manpower. AMR is also is a problem. We are trying to address the AMR. And dengue, which is now in the Southeast Asian region, it is a big problem, including in Bangladesh. Just to conclude, I must say that BD will remember, Bangladesh will remember Poonam Khetrapal for her dynamic leadership. During her time, all CRO countries' health system has improved and has got huge achievements. Bangladesh, I will say that during her time, Bangladesh could eradicate polio, tetanus, filariasis, Kala-Azar, and during the COVID, the guidance and technical support was immense. For that, we will always remember you. And whenever we are in Delhi, we enjoyed your presence. We feel at home that with your hospitality and with your presence. So we will always remember that. I take this opportunity also to for Dr. Tedros DG, that he has been supporting Bangladesh quite a lot. Entire this region he has supported, entire world. Bangladesh received one of the highest number of vaccine from COVAX facility, and also helping in setting up our national laboratory and other laboratory facilities we are having from Dr. Tedros. So finally, to conclude, we reiterate our commitment to achieving universal health coverage and ensuring quality health care for all, better nutrition services as envisaged in the 2030 agenda. We recapitulate CRO countries should have strong bonding not only for combating COVID-19 pandemic, but also for impending diseases like NCDs, TB, as well as to reduce maternal and child deaths, which will ensure the achievement of SDGs by 2019. So I will stop here, and I express my gratitude to once more to regional office and to the Government of India, and especially to the Health Minister and Health Ministry for your kind support and hospitality. And we wish all the good wishes for our member countries. We thank you. Joy Bangla. Assalamu alaikum. Good morning.
Thank you, Excellency. Now any more country? No. Distinguished delegates, thank you very much for these valuable insights. I'm sure all of us will learn from each other's initiatives and experience in further improving healthcare delivery. Excellencies and distinguished delegates, with this, we have come to the close of day 1 of this 76th session of the WHO Regional Committee for Southeast Asia. I sincerely thank you all for the successful conduct of this first day. You are aware that beginning 2014, we decided to include the ministerial roundtable as part of the regional committee. The ministerial roundtable on strengthening primary health care as a key element towards achieving universal health coverage shall take place tomorrow at 9 hours. Honorable ministers and heads of the delegations are invited to participate in the ministerial roundtable with the key staff. I am informed that following the ministerial roundtable, there will be a side event to acknowledge public health achievement in the region, which will be further followed by release of key publications by WHO. The detailed agenda of the day 2 will be shared in the daily session journal. That brings us to the close of our session today. Would the Secretariat wish to make any further announcement? Yes.
Yes, thank you very much. Honorable Minister of Health and Family Welfare India will be hosting a dinner tonight at 7 p.m. onwards. The venue of the dinner is Shashma Swaraj Bhawan. The liaison officers will escort the Honorable Minister's head of delegations through the main reception about 6:30 p.m. Buses have been provided and arranged for the remaining delegates, and the buses will be leaving 6:15 from the hotel. Therefore, all the delegates are kindly requested to be seated in advance. Physical activity for tomorrow, on 31st of October, there will be a yoga session sponsored by India in the garden outside of the hotel, well, inside of the hotel, but outside of the building, from 7 to 7:30 a.m. So also I would like to reiterate that the mobile app is being constantly updated, so all the information is being posted there. Thank you.
Thank you. Now, close of day 1, and I sincerely invite to dinner hosted by Ministry of Health, Government of India. Thank you. Today is closed.